Okay, now we are going to start on the medical surgical nursing, and that is that under oral health, alimentary and biliary condition. Here we are going to see the following objectives. We are going to ensure that we are able to see on structure, and we can describe the structure and function of the digestive system, can describe the function of the accessory structures of the digestion, describe food metabolism, that is how the food is being broken down with associated enzymes, check on the diagnose technique or how we can evaluate a condition related to this area, how we can manage, and how we can rehabilitate a patient who has suffered with associated condition, that is under the oral, biliary, and GAIT, that is gastrointestinal tract. Now, we are going to also be in position to utilize the nursing process in the management of adults with disorders of the digestive system. On completion of this chapter, now this is now the objective that as a learner is supposed to achieve. Describe the nursing management of patients with the condition of oral cavity. And you really need to know, when I'm saying nursing management, it comprises of tiny elements that you also need, like planning and the rest. We're going to check on how we're going to view on that. Then we also be in position to describe the relationship of dental hygiene and dental problems to nutrition. Describe the nursing management of patients with abnormalities of the lips, gums, teeth, mouth, salivary gland. So entirely all this one describing the nursing management of patients with the cancer. So there are conditions associated within the gut, from the mouth right to the anus. That is the entire length of what we call the alimentary canal. So let us now begin. Here is a structure you can see from your hand. This is a diagram representing typical digestive system. Diagram representing from your hand. I'm very sure you are in position to view. And so these are common things that we've already evaluated ever since we started from primary school to high school, and you can be in a position to locate each organ using your observation skills, even when a patient comes, and then you can observe the patient's gait, and you will just be in position to diagnose the patient from the aspect of observation. You will actually have an impression to alternative, like 3 options of organ that can be causing the problem just from your look. So you are supposed to be having a framework or diagram of the entire anatomy and structural orientation of the digestive system, from the palates in the mouth and the oral cavity, the epiglottis, the salivary gland, larynx, up to the last part, that is the anus. I'll be adding individual as they enter. So now, similarly, this is the same thing now, but now the digestive system for a female, of what nothing differs from a female and a male. The structure is similar. You can see on the parotid glands, pharynx. Yeah, there is no difference between the anatomy of a man and a female in terms of the digestive system or any other system. What differs is only the reproductive system that differs, and some hormonal organs, the glands that secrete hormone. Those are the only thing that differs from female and male. So beginning, we are going to see on the review of the anatomy and physiology of the digestive system, and we have 5 main headings that you need to know. You need to be in position to distinguish and differentiate between the following: ingestion, secretion, propulsion, digestion, absorption, and elimination. Beginning from ingestion, this is the process of taking food into the mouth. We all know that one. Yeah? Then we chew it, and then it also gets into the alimentary tract. Then secretion is now the digestive juice, how they are being produced. Is the secretion of digestive juice, like the example you've been given, saliva being secreted by 3 glands in your oral, that is the mucosa, let me just say the subarachnoid, sublingual, and mandibular glands. And then we have the hydrochloric acid as well. Those are just secretion. Then propulsion, the movement or the ability of the gut to propel. So that is the movement of the contents along the alimentary tract. Then digestion, we all know it consists of the mechanical breakdown of food, mastication, that is the chewing. Then we have chemical digestion and mechanical digestion. So mechanical digestion is what involves the chewing because it is physical, but chemical digestion, it has to do with the enzyme which helps on the process. Another thing is absorption, which I'm very sure you know that now the food which have already been digested is supposed to be incorporated into the living tissue and they're being assimilated. So this is the process by which digested food substance passes the walls of the small or the organs of the alimentary canals into the blood and lymph capillaries for circulation, and they move all throughout the body to provide nutrients and oxygen. Then we have elimination. So in elimination, the food substances which have been eaten now are being removed because if they accumulate. So we are going to see. You need to know the classes of food that is under nutrition. I know you know the macronutrients and the micro. You're supposed to classify them. And macronutrients, where now we have the carbohydrates, the proteins, yeah, and the lipids. And the micro, you know them. Then you also need to know digestion process, how it entails from the mouth, the process itself, the enzyme that participate, and the product of each event. From the mouth, what happens in the mouth? If it is starch being digested, it goes to maltose. You really need to evaluate this in a way that in a clinical phase, when a patient has come complaining of some sugar or salt taste in the mouth, you can relate definitely to food or the process, yeah, and so on and so forth. You also need to know the effect of food to the nature in terms of acidity and alkalinity of given organs. Now, end product of digestion, site of absorption, those are also important things that you need to know. So let's begin from the mouth. All these ones are just normal things. I'm very sure you are aware. That is why I'm summarizing. I want to go direct to the conditions and diseases that affect the GIT, the biliary system, as we proceed. Now, from the mouth, you know what happens? There's chewing, and then there is that mixing of the food with the saliva that contain an enzyme typically known as the ptyalin. Then the tongue itself will perform taste function because it has got some receptor-like cells. We call them the taste buds. So they turn food into the mouth that is then chewed. That act of chewing is what we call the mastication, and then later on being swallowed. Then we have a pharynx, is also involved in both swallowing food, yeah, and it gives an head pusher for the sound. So that is that. That is a structural orientation of the internal part of a tooth. And as you can see, why do we learn this one? Because at most in the oral cavity we have condition affecting both the mouth, the tongue, and even the teeth. So you need to know the lining of the teeth, the nerves, and so when a patient comes with a dental condition, you can relate, you can associate, and then you can give a considerate management scheme for the patient. Now you can see we have blood supplied in the inner cavity, yeah, that is called pulp cavity. So we have also dentine, we have the cement also layer, and this one is something which you've ever known. The upper part is crown and then root. Tooth decay, this one you all know because the food which we eat every day, they are worked on by the bacteria, and then they are fermented. That is the carbohydrate. After they are being fermented, they become somehow acidic in nature, and then they'll now dissolve the enamel. So this acid is produced by bacteria. When they break food or sugar on the tooth surface, they will now digest, the acid itself digests the enamel, which is the outermost part of the teeth. And because after that one, now the enamel, because the strongest and the hardest, so if it is broken down, the other layers of the teeth are just but loose, so they can also be worked on very quickly, and therefore dental condition can really proceed within a short time. Now this is the pathophysiology. This one is the pathophysiology, just simple. Acid is produced by the bacteria when they break food or sugar on the tooth surface. Then when the acid is too much and it doesn't clean, that is the problem with people who don't brush regularly. So you end up having it for long, and then the enamel is exposed for long, and that is also causing what now we have as tooth decay, or maybe this other condition to do with the teeth like gingivitis, cavities, and all that. Bacteria now goes into the dentine after enamel, and that pathology is just simple. So diagnosis first, clinical examination. Clinical examination simply consists of the normal IPPA that we know. Yeah, so it embed the entire thing: general examination and physical examination. Whereby general examination starts from the gates, how the patient approach you, yeah, the pain when she or she is talking, you can relate. The teeth is like, yeah, and then the swelling, you can do that one by observation. You can also touch, you can palpate some parts and see. So clinical examination also involves the history. So you also can consider taking the history of the patient, know the kind of the life the patient is living, that is in terms of the social history, social economic history, because some people are subjected to sweet and some common food that we are very sure that they are associated with. And then you can take radiographs, especially If a dental condition, like previously it was 2 nights ago, I was in the hospital working, then there's somebody who came with an accident, actually road transport accident. So on that basis, the upper canines, I'm not actually, they were not canines, they were incisors. They were already loose. So everything behind this that we could not relate because we were sure there is a fracture somewhere. But because the radiograph was not already with us, we could not have configured our diagnosis and even management with us. So radiograph also is important, even if you want to uproot or maybe give a root canal filling and so on and so forth. All those ones, removal of the tooth, filling, they require information of the alignment of the teeth, how the problem is, and so the entire thing you need also radiograph to confirm. So the factor that contribute to dental erosion, nutrients. So when you're taking your history, you talk about the nutrients, the nutrition, genetic predisposition. You can inquire about the family line, kama kuna mtu alikuwa na shida ya meno. Presence of dental plague. Dental plague is galantic-like substance that adheres to the teeth, then initiate action that causes damage of the tooth occurs, and then dental plague appears. Yeah, so you can also see some diseases can also result to decrease in saliva, such as diabetes, and when your mouth is dry, the bacteria remains intact, and therefore, at last, the acid remains there, and there's nothing to sweep the acid away. The disease is very, very predisposed by that. Medication, some drugs, like example, we have antihistamines. I hope you know them. We have antihistamine classified depending on the receptor, the antihistamine 1 and the antihistamine 2. So you need to know what they do and how they affect in terms of their mechanism of action, how they interfere with saliva production. Because you really know that the histamine in category 1 receptor, they normally reduce mucus production. And by that, they also reduce secretion of saliva, because saliva has got a component of mucus which lubricate food. So like things to do with that is why most of the antihistamine, they result with the side effect, or maybe the adverse effect, which we call the dry mouth. Yeah, you remember, fatigue, constipation, because of that effect. So antihistamines like the diphenhydramine, the cetirizine, the hydramate, all those ones, the ceclizine, the meclizine, all of them can also cause saliva decrease. Then poverty, huyu jamaa kuli ama ana mswaki ya kupiga meno. So poverty is one attribute also which can result to dental erosion. Then poor cleaning of the mouth, and the age-related oral dryness. Ukishazeeka sana, you get old people, their mouth is always dry. So that is that. Because actually of degeneration of the gland, you know, you can be asked. Yeah. So that is that. So let us just be at quick. I want you to give me probable 3 ways of which you can manage according to your current knowledge. I'm very sure that right now you are informed. Try to illustrate or give, but when you're giving an answer, try to at least speak it out, that we can hear. So try to, who can tell us the treatment mode that we can accord to patients with such conditions? Okay, let's proceed because all of you are silent. Now, treatment, we do demineralization. We brush with the fluoride and flossing. We use flossing. I know flossing, you know, those kind of rope that we use to remove. So yeah, we use the fluoride, which is a mineral, and the flossing application by the dentist is enough to stop the progress of tooth decay. That is what we call enamel demineralization. Then we have dental restoration by filling. So that is done when the tooth decay has reached the soft dentin and the tooth cannot repair itself. Then you have root canal treatment, tooth extraction, and tooth replacement. Root canal treatment, we just fill the canal of the root completely so that the nerves, even they cannot feel any pain resulting from the decay, especially when the cavity is so deep until it has already reached in the pulp cavity. We have tooth extraction and tooth replacement as well. So tooth extraction, we just remove it completely. Surgically, we remove it by the help of some local anesthesia like lidocaine, and then that is that. So then we can have tooth replacement, but we don't replace teeth with a natural teeth, but instead we replace tooth with that and something to do prosthetic teeth, or maybe just say artificial ones. Complication: you can have severe pain, you can have tooth abscess, you can have sepsis. So pain is common because the entire thing, pain is common because there is nerve supply to the pulp cavity of a tooth. That is, when the cavity reaches the pulp cavity, when the cavity formed by the bacteria reaches the pulp cavity, it can interfere with the nerve and therefore cause pain. We have tooth abscess due to injury, or maybe an abscess can be due to the ulceration or maybe destruction of the gum and the tooth itself up to the inner deep part of the root. Sepsis, that is infection related to tooth decay, pass around the affected tooth, risk of breaking or chipping of the tooth, and difficulty in chewing. Those are complications. Then you have prevention of dental caries, regular cleaning of, these are just common things. Flossing between your teeth at least once daily, a diet low in starches, you don't use sugars too much, small amount of fluoride in form of fluorinated water. Then refrain from smoking. Smoking will now decrease wound healing suppression, and it will decrease wound healing, and it will also suppress antibody production. So it also reduces neutrophilic phagocytosis and control it. It can also be controlled or prevented by controlling diabetes, because we say diabetes is one of the attributes of tooth decay by giving a reduction of saliva production. Can have regular dental screening as well. Oral thrush, that is another thing. Oral thrush, these are just still conditions found in the mouth. Oral thrush ni zile vitu za white, unaweza pata mtu akikutolea ulimi nje utapata ndani ya mdomo yake kuna vitu nyeupe. So oral thrush is a cheesy white plaque, and that looks like milk. When rubbed off, it leaves an erythematous and bleeding base. So it can be commonly caused by Candida albicans, a fungi. Yeah, and oral thrush, Candida albicans affect even the vagina, the reproductive tract, that is the vagina lining, and therefore some vaginas of female are always also having the oral thrush or the white thrush. Can also be caused by the tropicans, the Clostridium tropicans nagibrata, and then predisposing factors are like when you are using a lot of dentures. Yeah, the mucosa is sheltered from oxygen and saliva when you use dentures. Then use of corticosteroid inhalers, reduce salivary flow, and high sugar diet can as well cause this one. Kama wale watu wanakula miwa sana, they normally tend to have the because of the sugar. Systemic factors that can attribute to oral thrush are like extreme age, ukizeeka sana. So the very young or the old. So if you're too young, you can also have oral thrush. If you're too old, you can also, yeah. Then you have endocrine disorders, can as well bring immunosuppression, like those people who are affected with HIV/AIDS. Oral thrush appears in the second stage of that disease. Broad spectrum antibiotics, some of them, not all of them, can as well bring into this. Nutritional deficiency and smoking. Then how do we diagnose? First, the same way, clinical examination. Second, oral swab for culture and sensitivity. Oral rinse and oral smear. Oral swab is just like swabbing. You take a swab and remove some sample of the content of your oral and then take it in the laboratory for culture, and you use sensitivity to rule in and rule out some basic microorganisms. So oral rinse and oral smear is almost the same. Signs and symptoms. First, creamy white lesion on your tongue, inner cheeks, and sometimes the roof of the mouth, and the gums and the tonsils. Slightly raised lesion with a cottage cheese-like appearance. Can also be presenting with the redness, burning, or soreness that may be severe enough to cause difficulty eating or swallowing. Another one is slight bleeding if lesions are rubbed or scrubbed. Cracking and redness at the corner of your mouth. Then we have a cottony feeling in your mouth, loss of taste, redness, irritation, and pain under the denture. Treatment: 1. Antifungal medication. Example, topical one, nystatin, or it is also referred to as the mycostatin, amphotericin B, clotrimazole, and ketoconazole. So those are just samples. There are several, there are several antifungal drugs we can get rid of the thrush, the candida thrush or the white thrush. So when using the suspension, the patient should wish vigorously for at least 1 minute, then swallow. Wishing means that you unaikudo, yani you wish you don't swallow it really fast, gargle it like you're gargling it. It stays in your mouth for some time before you swallow. And then that is that. You can treat the cause if it is bacteria related or immune suppression related. Kama watu ukimwi, you try always to treat the cause. You try to make sure that the compliance here with the drug is apprehended and the patient is up to date in terms of everything that can be lagging out. So then again, we have rinsing your mouth. That's one of the care with water after using corticosteroid, inhaler, or use a spacer device. Prevention, just rinsing the mouth. Brush your teeth at least twice a day. Check your dentures. See your dentist regularly. Watch what you eat. Control blood sugar, yeast infection, treat dry mouth. We are going to check on stomatitis in the next on oral GIT biliary condition. Thank you so much and enjoy the moment.